السلام عليكم ورحمة الله وبركاته. Today we will discuss the second part of second anatomy lecture in human body module about bone, cartilage and joints, and this part will be about joints. I am Professor Dr. Mona Mohammed Zuhair will be with you. Our resource and reference textbook Clinical Anatomy by Region, Introduction about Joints, and videos also about joints. Our session ILOs list the different types of joints in the body, define the characters and types of fibrous joints, differentiate between primary and secondary cartilaginous joints, identify the characters and classifications of synovial joints, list the factors maintaining joint stability with its nerve supply, define ligaments, bursa, and synovial sheath. Now, what is the definition of joint? It is a site where two or more bones come together, whether or not movement occurs between them. This means joint. A joint is the site where two bones meet each other, even if there is movement or there is not movement, it is called a joint. Joints are classified according to tissues that lie between the bones into fibrous, cartilaginous, and synovial. Thus, we have three types of joints in the human body. Fibrous joints. The articulating surface of the bones are joined by fibrous tissue, and thus very little movement is possible or no movement at all is possible. As sutures of the vault of the skull or skull cap and inferior tibiofibular joint, the joint between the lower ends of tibia and fibula. Cartilaginous joints. We have two types of cartilaginous joints, primary cartilaginous joints and secondary cartilaginous joints. Now let us differentiate between both types. We will differentiate about the structure, the movement, and the example. About the structure, primary cartilaginous joints, the bones are united by plate or bar of hyaline cartilage. But in secondary cartilaginous joints, bones are united by plate of fibrocartilage. About the movement, in primary cartilaginous joint, there is no movement. But in secondary cartilaginous joint, a small amount of movement is possible. Example, in primary cartilaginous joints, the union between epiphysis and diaphysis of a growing bone, and also between first rib and manubrium sterni of the sternum. Here is the union between epiphysis and diaphysis and epiphysis. It's called epiphyseal plate. This is example of primary cartilaginous joint. But in secondary cartilaginous joint, the joint between the vertebral bodies, intervertebral disc, and also symphysis pubis. What's symphysis pubis? It is the joint between the two pubic bones of hip bone. And here is the joint between the vertebrae or the intervertebral discs. The third type of joints is the synovial. Now let us enumerate the characters of synovial joints. First, number one, articular surfaces of the bones are covered by thin layer of hyaline cartilage called articular cartilage. Yes, these are the surfaces of bones covered by thin layer of hyaline cartilage called articular cartilage to decrease friction. Number two, the cavity of the joint is lined by synovial membrane. Here is synovial membrane cover the cavity, all the cavity except the articular surfaces. Number three, synovial membrane is protected from outside by tough fibrous capsule. Yes, there is tough fibrous capsule. to stabilize or protect the synovial membrane. Number 4, articular surfaces are lubricated by synovial fluid. The joint cavity contains fluid called synovial fluid, which is produced by this membrane, which is synovial membrane. Another character is in certain synovial joints, as the knee joint, menisci are present between articular surface of bones to decrease friction, because this joint is a weight-bearing joint. Here is the knee joint. There is a disc, articular disc, between the two bones called meniscus to decrease friction. Also, in some joints, there is fatty beds between the synovial membrane and fibrous capsule or the bone, as the hip and the knee joint. Here is the fat bed in the hip joint. Usually, the synovial joints is supported by ligament outside the capsule, but sometimes in some joints there are intracapsular ligaments or ligament inside the capsules, as cruciate ligaments الرباط الصليبي inside the knee joints, or the ligament of head of femur inside the hip joint, as this is the ligament of head of femur inside the hip joint, or the cruciate ligament inside the knee joint. It is intracapsular on inside the capsule. Now let us discuss classifications of synovial joints. Synovial joints are classified according to the shape or arrangement of articular surface and the type of movement into. Number 1, plane joints. In plane joints, the articular surface are flat and the type of movement is only sliding movement, حركة انزلاقية, as sternoclavicular and acromioclavicular joints. Here is sternoclavicular, the joint between the sternum and the clavicle, or acromioclavicular, the joint between the clavicle and the acromion of scapula. Number 2, hinge joints. In hinge joints, it resembles the hinge of door, زي مفصلة الباب. فالmovements only flexion and extension, as elbow joints. Here is the elbow joint. It is hinge. Permit only flexion and extension. It is uniaxial. Another type is pivot joints. In pivot joints, here, like atlantoaxial between atlas and axis, first and second cervical vertebrae, and superior radioulnar between the radius and the ulna superiorly. Here, there is a central bony pivot surrounded by bony ligamentous ring. Also here, the head of radius is a bony pivot, and here is a bony ligamentous ring with ulna. Allow only rotation. The only movement is rotation. Here is the examples: atlantoaxial between atlas and axis, first and second cervical vertebrae, and superior radioulnar joint, superior radioulnar. Another classification, condyloid. The articular surfaces are two distinct convex surfaces articulate with two concave surfaces. The movements are flexion, extension, abduction, adduction, like metacarpophalangeal joints. Metacarpophalangeal joints between the metacarpal and phalanges. Metacarpal and phalanges. Here is convex with concave. Ellipsoid. Elliptical convex articulate with elliptical concave, but the movements are flexion, extension, abduction, adduction without rotation, like wrist joint. Let us see, what is the ellipse? Ellipse is like this figure. That the joint is a cavity. Here is articular surface, convex with concave, but not round. It is ellipse in shape. But thus the movements are flexion, extension, abduction, and adduction without rotation, like wrist joint. Another type is a saddle. In the saddle joint, the articular surfaces are concavo-convex. Concavo-convex, this means that in one bone it is concavo-convex, and in other bone it is also a convex-concave. This permits flexion, extension, abduction, adduction, and also rotation. The concavo-convex shape allow rotation, like carpometacarpal joint of thumb, the joint between the carpal bone and the metacarpal of the thumb. Last type is ball and socket. In ball and socket, a ball-shaped head fits into socket-like concavity. Yes, this allows free movement. All types of movement are allowed. Flexion, extension, abduction, adduction, medial rotation, lateral rotation, and also circumduction, which is succession of movement. We study this movement in anatomical terminology lecture. And the example is hip and shoulder joint, مفصل الفخذ ومفصل الكتف. This is called ball and socket. The ball-shaped head fit in cup-shaped concave. Let us study another topic, which is stability of joints. The stability, the joint is stable, does not dislocate according to main factors. Number one, shape, size, and arrangement of articular surfaces as ball and socket. Yes, here ball and socket arrangement of hip joint. Number two, ligaments as fibrous ligament prevent excessive movement of joint, as the cruciate ligament in the knee joint prevents separation or dislocation between the two bones. Lastly, the tone of muscle around the joint, which is the major factor controlling stability. The most important factor is the tone of muscle, as in joint of the foot, it is supported by the tone of muscle of the leg, which is inserted into the bone of the foot. Now, the first is the size, the shape, and the arrangement of articular surface. Here is the ball and socket hip joint, prevent dislocation of the hip. Number two, the ligaments as cruciate ligament inside the knee joint, prevent excessive movements that prevent dislocation and allow stability. Lastly, the tone of muscle. It is the most important or major factor in controlling stability, as in joints of the bone of the foot, supported by tone of muscle of the leg, which inserted into the bone of the foot. Nerve supply of joints. The capsule of the joint and the ligament receive abundant sensory innervation, and sensory nerve supplying the joint also supplies the muscle, and the muscle which moves the joint and the skin overlying it, and this is called Hilton's law. This is called Hilton's law, the name of the science which discover this knowledge. Now let us define some structures related to the joint. Number one, a ligament. A ligament is a cord or band of connective tissue uniting two structures. Number two, bursa. Bursa is a lubricating closed fibrous sac lined by delicate smooth membrane, synovial membrane, containing synovial fluid. Number three, synovial sheath is a tubular bursa which surrounds the tendon of muscle. These are structures usually present in the joints: ligament, bursa, and synovial sheath. Now we finish our lecture. Let us see this in class exercise. Which of the following is the appropriate classification of the inferior tibiofibular joint? Cartilaginous, fibrous, hinge, saddle. Number 2, which of the following is a primary cartilaginous joint? Epiphyseal cartilage, intervertebral disc, knee joint, suture. Which of the following is an example of pivot synovial joint? Carpometacarpal joint of the thumb, metacarpophalangeal joint, shoulder joint, and superior radioulnar joint. Another question, which of the following joint is immovable? No movement. Primary cartilaginous joint, secondary cartilaginous joint, pivot joint, and plane joint. After falling on his right hand, 24-year-old tennis player complained of inability to move his forearm. Radiological examination revealed dislocation of the right superior radioulnar joint. Which of the following movement is affected by dislocation of that joint? Abduction, extension, flexion, or rotation? Which of the following shapes best describes the articular surface of saddle joint? Concave, concavo-convex, convex, or flat? Please try to answer these questions and send them to me on a private WhatsApp, and then we will discuss it with each other on the WhatsApp group. Thank you. Now we finish our lectures in Introduction to Anatomy. And any student want any illustration, you can send to me your question or on the WhatsApp group, and I will answer you. Thanks. Best wishes to all of you. Thanks.